So, yes. So we are all ready and set for today. And once again, I take the privilege to introduce our speaker for today, Ms. Jennifer Tavares. She wears a cap in multiple areas. So she's been a nurse, counselor, special educator, trainer, and lecturer. And she's very passionate and committed to what she does, and that we will see through our session today as well. So she has supported and empowered a lot of individuals across all ages. So we will benefit from her experience today, and her passion lies in counseling children with learning disability and ADHD and providing support for the parents as well. And then she is a key member of the core team at St. John's Research Institute, and she's developed to a lot of research as well. And she's also a founder of Pledge Academy. And with this, I've tried to compress this more, but we will kind of know through the process.
Right.
Over to you, Ms. Jennifer. So.
Thank you, Dr. Gauri, and a warm welcome to all of you who are here. I'm not sure how many of you attended last session. That was done in February. Unfortunately, in March, I couldn't do this second session, and therefore it got a bit delayed. However, in the first session, we did cover understanding ADHD. What were some of the causes? How do you screen a child with ADHD? There was one simulation also which was done, and what could be the general role of all those who are working in different fields of therapy who work with ADHD children. So in a nutshell, that is what we covered in the first session. I think Dr. Gauri has put the link in the chat box, so any of you are interested in seeing some of that, please do take a look. So we are here now to talk more about the interventions for ADHD. Actually, the session was supposed to be therapeutic interventions, but I've said let us just look at it broadly as interventions for ADHD so that we are looking at it from everyone's point of view. There may be some parents here, there may be some of you who work with children in schools, etc. So I'll try to touch on all of it. ADHD is a very, very wide topic. So if you are more interested, you please do read up. We are giving you some clues on what to read up at least, and therefore you could do some of these interventions for your child. I'm also aware that some of you may be attending, you have a young child, or you might be having an older child or an adult child. The child has now become an adult with ADHD. So we try to cover a little bit again about all the interventions here. All right, so can we get started? If any of you are comfortable to put on your videos, please do that so that we have some interaction. Otherwise, you can put your questions in the chat box as and when I will address it at some point. So very often, children with ADHD, and I mentioned it in the last session as well, they are the most misunderstood children either in the class or at home. Very often, we also call them very stubborn. However, I would like to say they are very strong willed children. Once they are determined to do something, they will do it from beginning to end. But how do we make them reach that point? That's what we are going to talk about. So I'm just going to share my PowerPoint and we can get started. All of you can see my screen? Yes? All right. Okay, so as I said, we are going to be talking about interventions for ADHD. First of all, let's look at the ADHD iceberg. All of us know an iceberg. We can only see what's above the water. We don't see what's beneath. And it's a description to understand ADHD a little better. It will probably recap some of the things that we did the last time. Very often, when we deal with children with ADHD, we see only them getting distracted, fidgeting, impulsive behaviors, attention issues, and so on. We rarely focus on what lies beneath. And what lies beneath are all that is mentioned over here, and I will try to cover interventions for most of this, which is mentioned beneath the tip of the iceberg. All right, so they have challenges in focusing, they have executive dysfunction, which is very often missed out. We try to get a child to focus without looking at executive dysfunction, emotional dysregulation, shifts in mood, relationship challenges. They find it very hard to keep friends, information processing issues, poor memory, poor time management, and forgetting to take care of basic needs. So we're going to look at some of these just to understand that a child will behave. Last time we discussed about neurotransmitters and all the other causes as why a child might have ADHD. So those are the causes. These are the symptoms that we see on a day-to-day basis. But a child is struggling. So what you see beneath this iceberg is shows you how much a child with ADHD struggles, and very often we think they are making up some of these issues. So very often people say, may have mentioned this word to you about executive function. So executive function has many skills. I think it has a total number of 12 skills, and which you can see over here. All right. And children with ADHD lack executive function. And it is, if they have ADHD, I'm going to address four of them, which are deeply impacted. All right. The first one is self-direction of attention. The last time you remember, we spoke about refocusing. Children with ADHD find it very difficult to refocus. They find it very difficult to, self direct themselves to focus on something. Like right now, all of you are probably focusing on this slide. But for a child with ADHD or a teenage or an adult with ADHD, if this does not interest them, they would not be able to direct themselves to pay attention to this particular slide. And therefore, because they are unable to self direct, very often we see that they don't meet deadlines, they forget responsibilities given to them. The frontal lobe, which is involved in executive function, also makes it difficult for the child because of the wiring of the brain. It is not that the child doesn't want to pay attention. The brain is wired differently that doesn't allow the child to self direct and to pay attention. And therefore if there are parents over here in the group, I would say, if you have a child already diagnosed with ADHD, maybe a young child, please tell this child you are going to handhold this child till they finish their studies. Make it clear with them that you are going to be a buddy when they are sitting to study, so that you are able to bring back their focus. All right, if they stay in locked up rooms, you may not be able to get them out of the room. Even if they are sitting on their own, let's say a dining table, they are not going to be able to self direct. You have to keep bringing them back to what they were doing so that they would be able to focus and finish the task at hand. We request teachers at school to keep them up in the front, keep tapping the table, keep asking them, pointing out to the word that you are, addressing in the class. All these are different tips to help the child to get back to the task at hand. The second point here is working memory. If you are listening to me right now, also comprehending, also thinking of questions, all this is because you have a good working memory. The other example I will give you when we use our working memory is, let's say I get into the kitchen now and I start cooking maybe palak paneer, and I do it without the recipe in hand. Then in that case, I am using my working memory to recall the steps of it in order for to finish cooking it and make it as good as possible. Another example is that if a child wants to add up, let's say 5 plus 4 plus 8, the child has to hold each bits of information in their mind in order to get the correct answer. So working memory is a very important executive function which is impacted in ADHD. And children can't hold these bits of information even to complete a task. So children might sit to do their task, whatever the homework, or they may even be sent to, for a swimming class or let's say badminton class. For each of these things, the child has to hold some bits of information. And that is why they give up, because they can't hold so many pieces of information in their mind. However, the good news is that it can be trained. Offload this working memory and make it more physical. How can you do that? We make visuals as parents, we make visuals at home to tell them what to do next. So there is pictorial pictures put up at home in order to help them to sequence, wake up in the morning, brush my teeth, take bath, breakfast, and so on. Once they master that, then we move to the next task. All right, so breaking down tasks, making it pictorial, visual is very helpful for children with ADHD. The other important part of for working memory is to reduce the distractions. If you are sitting with a child, you have to completely be, patient. You have to completely sit with that child without scrolling on your own phone. You have to be focused, and in that way, even role model to a child how to use their working memory. Also, practicing some memory exercises is very helpful. Sudoku, playing Scrabble, playing any board games is said to kickstart working memory. It is also said to enhance focus and attention. So maybe I said this last time towards the end when somebody asked a question. Board games, any game where there is sitting involved, builds sitting tolerance, it builds focus, it builds working memory. The next one here is inhibition. Okay, if I am sitting in a class and the teacher asks a question, and if I can't wait my turn and I blurt out my answer, it means the executive function of inhibition has not developed. So children with ADHD, we see that they blurt out answers, they can't, they run out of turn, they want to do their own thing, they are not able to hold back. And therefore, in order, if you're a parents over here, then if you see that happening very often, in order to prepare children for executive function under inhibition, it is always good to plan transitions. If you're taking the child to a shopping center, it's a transition. The child is going from home to the shopping center. Tell them what to expect. Tell the child whether you are going to buy him or her something. Make those rules before leaving the house. Probably repeat them just before you enter the shopping center. It helps the child to regulate, to know what to expect, and also to regulate their own impulses in then they will not do anything disruptive in that particular shopping center. Similarly, if you're going for a party or any place which is a transition, it's a new place for the child. A lot of us transition very easily, but children with ADHD have a lot of difficulty doing that. And if we don't correct this, if we don't help them in a young age, it leads to social anxiety in adult life. They want to avoid going out because they don't know how to manage this transition. So that is one, that is managing transitions. The second one is delayed gratification. A lot of parents, probably because they have too many things to do, and they give in to some of the demands that the child may make. This is not just with ADHD, it is with any child. Yes, sometimes it is okay. But for ADHD children, sometimes we've got to delay saying a yes or delay saying a no also, because the moment you give them an answer, they get some kind of gratification. So if a child comes and asks you at 5 o'clock in the evening, can I have some ice cream? And you want them to have it after dinner. There's no need to say a yes or no. You say that you can have it after dinner. So stressing on the after makes the child understand it's going to come after a point of time. And so therefore you might get the child within 10 minutes in the kitchen saying, okay, give me dinner, because they can't wait for the ice cream. So you will see these patterns happening with your child. However, be alert to understand that what you do today will reap the rewards maybe 5, 6, or 10 years forward. The other part in terms of inhibition is to use situation cards. That means imaginary situations. Asking the child, if you were bullied at school, what would you do? I'll show you some of those cards when I exit this PowerPoint. These are good ways of discussing, different situations without the child actually being in the situation. So let's say you get a couple of complaints from the school that the child is not able to sit, the child is not able to do this or that. Pick up a situation of another child, not necessarily someone you know, just make up a story and say, this child did this. What would you do in that situation? So getting them to speak And there's no need to jump in and say your answer is right or wrong, but we're getting to know what's on their mind. You might also understand these things are happening to your own child while they are at school. So that's about inhibition. The next one is time sense. Many parents tell me that, my child who has ADHD is blind to time. They don't understand what is the meaning. They'll say 5 minutes, but that 5 minutes becomes 5 hours. Remember, children with ADHD, even adults with ADHD, they do not understand time. They tend to overestimate the time. So let's say you tell them you have 1 week for a project. Other children might count it as 7 days. But children with ADHD don't get that there are 7 days and that, they think, oh, we have a lot of time. 7 days is, a lot of time. I don't need to get started right away. The other part of time sense is that they don't like to wait for anything, and that's connected with inhibition, but they don't like to wait. So even if you tell them 5 minutes, you tell them wait for 5 minutes, they get very bothered, they start throwing tantrums and so on. Now, to understand this time sense, because this is a problem with many children, we must understand two things. First comes hindsight. Let us say today you ask me to write a project. I have done it many times before. So therefore, I know what is expected and how much time I will take, etc., etc. I'm talking if I was a child. Most neurotypical children, they know how to plan their work. But children who have ADHD, they lack that hindsight. They forget. They are not able to remember how much of time or how did they work on something, the sequence of it. They are not able to remember that. And therefore, when they are given a task to do, they get all bothered because they act like it's a new, not act, they think that this is a new task, something brand new I'm doing. And so, therefore, it is good for you to remind your child. Let's say today your child has done some kind of a project, all right? The next day, remind them the steps that they did. What did you do? You cut pictures, you first asked me to buy this. Make those steps known to the child again and again, so that the next time they have a project, they won't be telling you at 10 o'clock in the night, look, I have need these pictures, I have to go to the stationery shop for a printout, because they would remember the steps if you keep repeating it to them. And because if I know what I did in the past, I will also know what to do in the future. Okay, so I hope all of you have got that children with ADHD, they don't mean to not do something. They just lack that time sense, and therefore another good way to manage time sense is also to keep a big digital clock somewhere. If they have started work at 7 o'clock, tell them you have to finish it by 7:15. Digital clocks work better than the analog clock for children with ADHD. And this is very important to do. Also, I used to use a big calendar with numbers, and I used to write on that calendar what was expected of them on a particular day. I'm with my own child, I would do that. So, just a general calendar, nothing fancy, which can also make them understand. I'm not talking about digital calendars, I'm talking about actual calendars, which you get with a big print, anything that you find, which is month wise. So you can mark on that, you have to submit your homework on this particular day, you circle it. So then they are able to get all these extra tips. Whatever I'm saying today needs to be done diligently, patiently, consistently. If you do this all the time, then the child will be able to learn it for a long time, because we are rewiring the brain. The network of a child with a brain is different. And so, in order to rewire it, we need to do these things continuously, get them to understand, etc. So I will continue, but I hope all of you understood that executive functions, what I've meant. There are 12 executive functions, but these are the main four that get impacted in ADHD. Yeah. Some treatment strategies that are put out over here, that you could see over here, many people might have already told you about behavior therapy, parental guidance, and medication. Last time we did speak a little bit about medication as well. Behavior therapy is another therapy that you could seek. There are a lot of behavior therapists available. They will guide. I always say that take, as parents, take the guidance so that you could do these things on a daily basis rather than a behavior therapist doing it only once a week. So if you're seeing a behavior therapist, learn from them so that you could go back home and continue to do most of the things back at home as well. The first point here, and if you remember, even last time I spoke about empathy. I hear a lot of parents telling me that their child does not have empathy. Now, the best way to teach the child empathy is to be an empathetic parent. Show them you understand that they are struggling, that they can't focus. Show them that. Our brains have something called as mirror neurons. If we show empathy, the child will show that back to us. And it can be very, very stressful to have a child with ADHD at home. You might be saying, what is Jennifer saying? Be empathetic. This child is driving me mad and she's telling me to be empathetic. I totally understand. However, when there are good days with your child, do try to show them that you do understand them. Having the parent as their backbone, as their support, is the biggest treatment that they could have. The next one here is diagnosis and early intervention. If you all haven't yet done that, if you all haven't got a diagnosis and you are still thinking, oh, why is my child like this? Why is my child like that? And your child is already 6 years and above, please do meet clinical psychologist or psychiatrist and get a diagnosis made in order to start the early intervention, especially for the executive function. The earlier you start, the wiring of the brain, starts to network better, rewire better, and we see better outcomes if diagnosis and early intervention is done on time. It's never too late. If you haven't started, please do start. Then comes general exercise. Because these children don't finish their writing work at school, these poor children are made to write at home. And so they don't get any playtime. However, general exercise is the key to ADHD. Managing ADHD, sending your child for unstructured play. If you want to send them for football coaching or whatever coaching, it's fine. But general exercise, again, helps the neurons to fire together. And therefore, the brain rewires better. Then occupational therapy, the ones with the asterisk marks are where you have to go to the experts for. Okay. Now, very often parents ask me, why are you recommending occupational therapy? Occupational therapy helps in the executive function that we just spoke. The occupational therapist can help with self-regulation, can help you to, develop the social skills, fine motor skills, gross motor skills, all of which, and also the sensory processing issues with a child with ADHD may have. So an occupational therapist would take care of all of these. Do we have any occupational therapists here today that you know of? Anybody wants to unmute if you're an occupational therapist and tell us what you do with a child with ADHD? Nobody? Okay. No one is here. So, but if you go to an occupational therapist, they do their own assessment and then they guide you from there, depending on what areas the child needs. Again, if you're choosing for occupational therapy, don't take 4 weeks of treatment and then stop. We see little improvement, we stop. I know it's tedious for a parent to, take the child, but what we've seen is children who go for long-term therapy until the therapist says now you can stop or weans you off the therapy, only then you should do that. Otherwise, again, the rewiring of the brain may not happen to its full potential. Okay, so therefore, it's important for the child to get this is if it is advised. I'm just giving you the various therapies and how it can help. It is up to the doctor, treating doctor, or the clinical psychologist to guide you on these therapies. Then comes concentration enhancement techniques. This is my favorite because this is something I did with my own child. We were not allowed to medicate her. Pediatrician didn't give permission back then. I'm talking about, 16 years ago. and they're not 16, maybe more than that, like maybe less than that. However, what we did, and this is all through just hearing from other parents that I was doing my training, special educator training, and this is what we did. We played a lot of board games with her. I can share with you through Dr. Gauri. I can share what we have prepared, and you could use these techniques based on the age of the child. Mandala coloring, you get these mandalas. You can just print it out free from the internet, making a child sit and doing that coloring. It doesn't have to be the full thing. It doesn't have to be neat, but it is getting a child to focus for short periods of time. So 15 minutes a day, if you do this, these concentration enhancement techniques, and then build it up as the child grows to 20 minutes, 25 minutes, you will see the sitting tolerance increasing. You'll also see the concentration span increasing. The next one is brain gym exercises, yoga, and balance activities. Now, all these others which we are recommending should go together with other therapies that the doctor has advised. But some of these things can be done at home. Many of you might have heard of brain gym exercises, but just to tell you what they are exercises that contribute to the neuroplasticity in the brain. That means if you want to see changes in the brain gym exercises are very good. Even you can do them. It will help you to remember, it will help you to focus better. The crossover exercises are very, very important for children with ADHD. What we mean by crossover, that means we make them crawl. We put your right hand to the left hand to the right side, and we make them crawl, or we make them, jump on the park, which has those rods. We ask them to cross over their hand and go. The crossing over activities help the two sides of the brain to rewire, to connect, and to interact with each other. If the child does a lot of brain gym exercises, what we've also seen, it increases the neurotransmitter dopamine, and the child is able to concentrate better. Plus, it increases motivation. So many parents who feel their child is not motivated enough, do these exercises together with your child, because if you make them do it alone, they may not be happy. If your child is going for yoga or any other balance activities, there are a lot of other activities that you can find on the internet. That's why we are just giving you clues so that you'll be able to search for these on the net. The next one is social stories. Initially, social stories came as a therapy for children with autism. Today, we use it for all the children. Okay, through stories, we are telling them what is appropriate behavior. Okay, so we don't focus on what is bad. We are focusing on the appropriate behavior. You can Google up, you will get lots of social stories. I would say take those examples, make up your own stories, and share them with your child. Storytelling has always been a good method to reach children on various topics. Okay, so the good part about social stories is that it externalizes the behavior. So let's say you want to deal with your child's behavior. Instead of telling them you are not doing this right, you should be doing it like this. You are telling them a story about another child with another name. So they listen to that story very with a lot of intrigue, and they understand how to then regulate their own behaviors. Because when you point out at their behavior, then there are shutting down, they don't listen, and so on. Role playing. A lot of parents also tell me their children don't like to write. I don't know how many parents are there in this group, but how many of you write? How many of you sit down with your child and you are writing? Perhaps one or two, or maybe more. I'm not very sure. But role playing, if you want your child to do something, I mean, this is for neurotypical children as well. Role playing is very, very important. So if your child doesn't like to do something like reading or writing, you have to do it first. Okay. And just to add over here, a lot of parents come back from office, they sit down, they'll get someone to make them a cup of tea, and then pick up the phone and start scrolling on the phone saying, I need to relax. The message going to a child with ADHD is that, okay, this is how I have to relax. So please give me a phone as well. Okay, so role play how you manage your stress as well, not just reading, writing, and so on. And the last most important point put over here is sleep. All of us, without sleep, our brains won't work. But for children, they need with ADHD, they need proper sleep. And so making sure that they have their bedtime routine, they go to sleep for at least 8 to 10 hours is very, very important in order to be refreshed to be able to refocus the next day. Right. If there are any questions till now, I would want to take it. Any questions? Okay. Somebody has asked what to expect from behavioral and occupational therapy. I think I answered that. Behavioral therapy, they will teach you the child's triggers, what is leading them to behave the way, and how to reward the child if they if they perform appropriate behavior. Occupational therapy deals with executive functioning and sensory processing issues. They help the and even fine motor skills. So it's a set of therapy that will help the child even to build the sitting tolerance and focus. Okay, so any other questions? What can you suggest to a parent who overfeeds the child info on his or her condition that he can use it to task escapism while in school? Um, Maybe I'll take that question a bit later. I'll come back to that. But anything related to this particular slide?
Ma'am, one just thing to add up here,
Hmm.
I guess even the emotion regulation part, even I guess that will be even helpful for ADHD children.
It's there on the next slide. All right. So emotional regulation is very important. You're very right, Kastuba. And thank you for saying that. All right. The first part of emotional regulation is to teach any child to label that emotion and then how to manage it. What we find is that teaching children at a young age breathing techniques, neurotypical or neurodiverse, can be very helpful when they are in their teens because they have already developed a coping mechanism. Okay, so there one of the ways of emotional regulation is first labeling the emotion. Second is helping them to use appropriate techniques so that they will be able to regulate without the parent being with them. Okay, and the third most important one is co-regulation. Co-regulation is where a parent sits with a child. The child has come back from school, has had a very hard day at school. Instead of telling the child, you've done something wrong, just being with a child trying to understand is also a very good form of regulation. The child doesn't feel that he or she is alone. The reason why they have, intense emotions is because of their thoughts. They can't do certain activities. However, we parents or teachers interpret it as they won't do it. You don't want to do this. I know you don't want to do this. But then in the child's mind, it is, I can't do it. I can't focus. You're asking me to focus, but I can't focus. It's like telling a diabetic, regulate your sugar without medicine. So these are the important areas to think about when you are with a child who needs to help them to regulate. So, emotional regulation is another teaching moment for parents and teachers to teach the child how to regulate their emotion. Okay. And the next one is dealing with dishonesty. This might answer the question which was in the chat, but I'll come back to that question. Lots of parents say that, my child tells me a lot of lies. And that is what makes me very angry. Why is my child telling me lies? It's like the child is breaking some kind of a value system at home, and therefore it upsets the child. Agreed. However, for children with ADHD, lying is often a coping mechanism. Don't take it personally. As parents and teachers, don't take it personally. Don't think, oh my God, I'm his mother. How can he lie to me? No, it's nothing like that. They don't mean to target you personally, but don't take the lying personally. Lying takes away the pressure of having to figure out how to do certain tasks. For many children with ADHD, They prefer to tell a lie than to get into trouble. It's easy, no? Let me just tell the teacher I've done it or tell my parent I've done it. Why get into trouble? So therefore, it becomes a coping mechanism. Now, if you see this over here, it says I have ADHD. So of course I forget things. However, when I tell people I forget, they sometimes think I am lying. All right. So this is another area that we need to focus on. Just happened. A lie also is a way to cover up for their forgetfulness. All right, they tend to um, second. They tend to cover up because they forget to do things. It's not that they mean to forget it, but they forget to do things. Then to avoid criticism or punishment, or to avoid dealing with feelings of guilt and shame over repeated failures or repeated forgetting. Okay, so remember again, it's a coping mechanism that they are using. The first step in dealing with chronic dishonesty is to find reasons that underlie it. Okay, so if a child is, the child is constantly telling you lies, one of the reasons could be impulsivity. Just blurt out, just tell the lie. All right. And sometimes you might just want to listen to that. And then after a couple of, like 30 minutes, go back and tell the child, now, do you want to tell me what happened? All right. Have you calmed down? Would you want to tell me really what happened? But whatever the answer is, if you beat the child or if you react in a way, remember our body language, they can pick up our body language. They will definitely get more upset and they are going to further lie to you going forward. And the other reason could also mean they can't manage their emotions. They can't, they're so dysregulated after coming back from school. So let me just tell a lie. No, ma, I don't have any homework. It's a lie. All right. Because they don't want to sit and do anything more because they have been regulating their emotions the whole day at school. The moment they come back home, they want to relax. If your child lies to avoid consequences for irresponsible behaviors, you must monitor those behaviors more closely. Since we know that children with ADHD tend to, are more prone to drinking, smoking, and so on, just because it gives them gratification and also because it gives them friendships, we need to monitor those behaviors more closely. And if he or she lies in order to avoid the guilt and shame, imagine a child coming one more day time and saying, I have failed or I have not been able to complete this, the teacher scolded. They feel guilty, they feel ashamed of themselves. So sometimes they are lying just to cover up and then encourage your child to be honest and work with forgetfulness. Okay, so these are important points because a lot of times parents do tell me that their child with ADHD is lying. All right. I know there are questions in the chat box. I'll just complete and come to that. Some general information. As I told you, a child with ADHD is all over the place. All right. How you start your day with them without shouting, sending them happily out of the house is very important for them to have a calm day. Other general information is that there are studies done. This is by Russell Barkley. Studies have been done, longitudinal studies, children with ADHD and when they are adults, it shows that if they have some of these, what I mentioned over here, then we see them better settled, we see better outcomes. So, greater intelligence, more education, that means don't pull your child out of the school. You might opt for an open schooling system, but see that they get their education. Children who have milder symptoms of ADHD. So if children have intense symptoms of ADHD, then going in for all these therapies and then even choosing medication is an option in order to help the child to finish the education. The absence of other psychological disorders. Last time you remember I had an infographic which spoke about anxiety, depression, oppositional defiant disorders. So the absence of any other psychological disorders also can be helpful. Families who have better socio-economic circumstances are able to give better therapy, better education to the child. Remember, syllabus is very important. If the child is not coping in the current syllabus, it's always better to choose a suitable syllabus. Sorry. Having a two-parent household, I understand sometimes the father may be living in another city, etc., etc. This is what is suggested, and so I'm putting it out here. But two parents in a household can take turns in taking care of the child and managing the child better. Having better neighborhoods and societies that understand the child, and if the child has more friends in childhood, then we see better outcomes in adult life. Recently, I did counseling for a young adult, a male, and he told me he has no friends. Right from childhood, he has no friends. And that kind of hit me hard, that how did he manage? Friends are the oxygen for life. It must have been really difficult. My last slide, then I'll go to questions and answers, is encourage instead of praise. Okay, because when we encourage the child, we are building intrinsic motivation. We are not, then we are reducing the dependency on praise. And when we reduce the dependency on praise, then again we are regulating the child from inside to do what he or she would has to do. Instead of waiting for mother or father to praise me, I'm able to do it myself. So these are just some examples of how you could tell them different things. You could take a screenshot of it if you want. There's lots available on the internet as well. I love the way you listened to that story. You saved all your questions to the end. Thank you for giving Prem the time to give his answer. Teacher could use this in the class. I know that this was a bit boring, but you persevered. Fantastic. Your imagination is brilliant. Let's write it down on a piece of paper before you forget. Okay, so these are just some examples on how you could use different statements with your child with ADHD. Okay, we'll go to question and answers. And don't forget, I told you in the beginning, an ADHDer needs a patient mother, a patient teacher, a patient dad, grandparents, everyone. We need buckets and buckets of patience to get through the entire childhood that they are facing. All right, I'll just go to the chat box and see from the question.
I can read the questions for you, ma'am.
Okay,
Yeah. This is from Alicia Verma. Hello, ma'am. What to expect from behavioral and occupation
I
therapy?
answered that.
Okay, okay. And the next one by Sangeeta
Yeah,
Nair. I guess it's done, or we have to
no, you
discuss it.
can tell me. You can tell
Yeah,
me.
okay. What can you
So,
suggest to a
sorry,
parent?
Kaustubh, one
Yeah,
second. So, if anybody wants to unmute and ask the questions, also you can unmute, put on your videos and talk, or we will take the questions from the chat
We
box.
will finish from here and then we'll go to the
Yes.
unmuting. No problem.
yeah,
Yeah.
okay. What can you suggest to a parent who overfeed the child info on his or her condition that he use it as a task escapism while in school? This is from Sangeeta K. Nair.
Sangeeta, I would say talk to the parent. All right. The child should know about his or her condition. All right. But if a child is using that information to escape from the task at hand, it could be other issues also. See, most children want to be like every other child in the classroom. So talk to the parent, guide the parent as to how much to tell the child, what is required to tell the child, and then take it from there. Okay, because when people come to us, we tell them, do tell your child that you have a difficulty and ask the child how you can help them. The idea is not to just give information. The idea is, see, we understand you have these, A, B, C. Now tell me, how can I help you? Okay, so Sangeeta, I hope I've answered that. Yeah.
The next question is from Miss Noor Aisha. Sensory motor mannerism, how do we regulate it other than blocking and redirecting?
Uh, I'm not very sure what you mean by sensory motor mannerism. Do you mean tics or do you mean something else? Noor, do you want to unmute and tell us?
Yeah, ma'am. Like sensory. Hi, myself Noor Aisha.
Yeah.
I'm a supervisor in working in Samvad Institute. Uh,
Okay.
so motor, my question is like the sensory things, ma'am. Like a child with ADHD has like sensory hand flapping or hand molding, where that sensory can be only there is a like as over and time I have heard only blocking and redirecting. So
Hmm.
my question is that how do we regulate that things?
Can the others mute, please? Request the others to please mute because I can't mute you. Yeah. So, Noor, just to tell you, I'm not sure if this child is going for occupational therapy, but if not, it is better to send them for therapy so that some of these things can get regulated in the by doing occupational therapy. Okay, so there are a lot of techniques. I'm not an occupational therapist to tell you
Okay,
about
so
this.
overall you mean that OT can regulate the sensory
Yes,
issues, ma'am?
yes, yes, yes.
Okay.
Okay, so you can send a note that these are your observations. You can send a note and they would be able to take it from.
Okay, what's the role of diet in this controlling ADHD and management of ADHD, ma'am?
See, there have been a lot of articles written. Some people say control the sugar. Some people say there's nothing like that. Okay, just give the child a balanced diet. That's the most important thing. These children need more energy, so therefore, energy yielding foods is important. Okay, other giving them protein in their food. But other than that, the general do's and don'ts. No child should be eating junk food. So definitely ADHD children fall in that category. So a good balanced diet holds good for any child. Okay. Yeah, we'll go
Thank
to
you.
the next question.
Yes, ma'am. This is again from Miss Laisha Verma. How
Hmm.
to deal with the honest answers? Like, I don't know why I did it.
I'm assuming your child said this, Lizzie, or I don't know whether it's your teacher. I think it's your child, maybe. So, if a child has given you an honest answer like this, like I don't know why I did it, it's not a complete answer. They don't know why they did it. Okay, give them some pen and paper, ask them to draw. Come on, can you draw why you probably did it? Be creative in getting the answer if it's important for you. Okay, if it is something, I told you that very often impulsivity is very high in these children, and therefore they do it. There's no reason for doing it. I still remember we were in I don't remember where we were at some hill station, and suddenly my daughter left my hand and crossed the road. She must have been about 8 years old, and she said, "I don't know why I did it." We didn't focus on the action. We did a social story with her a little later on in the day. My heart was in my mouth because that was a highway and she jumped across the road. Okay, so we did a social story on it. And we kept repeating that social story till she understood, you know, crossing the road without looking left and right and center and so on is very important. Okay, so there are different ways to deal with it after that. Appreciate the child's honesty is something that, that, okay, thanks for telling me that. All right, and then later on dealing with what you can. Okay, we'll go to the next question.
Yes, ma'am. It's again from Miss Lysi Verma.
Yeah.
OT suggested us tire him out approach for his hyperactivity, but my kid just won't get tired. Are there any alternatives? He is not even getting tired at the center.
Sometimes we have the other end of the extreme where the child is very dull, not able to even get up from the bed, not do anything. Here you have a child like this. Okay, now what I'm also understanding is probably this is tiring you all also out. Okay, so some outsourcing, get probably a maid to take care of him for a couple of hours, or get him to do some sports where he'll be under the coach. So, that's how it is. But sometimes children don't even know how to label and understand they are tired. So give him some symptoms like, your legs are paining, him or her, whoever it is. Are your legs paining? Are your hands paining? Are you hungry? All these are indications. Children sometimes don't know how to say it themselves. We are tired, we are hungry, we are anything. So we have to train them to do all these things. Okay. Yeah. Are there
Yes,
any
ma'am.
questions on
From
YouTube?
No, from the chat, it's done. If anybody wants to unmute and ask the questions, the platform is there to ask.
Anything on YouTube?
There's nothing so far on
Okay,
YouTube.
right.
Ma'am, also, I guess even the diet we need to take care of, kids with hyperactivity and this thing, even the sugar level, the
Yes.
sweet, I guess that even adds up here. What Miss
That's what
Laisha has
your
asked.
balanced diet.
Diet.
Won't give other children. I would not give my other child also sweets and sugar or anything in excess. So everything should be in proportion to what a child needs. Okay, so a balanced diet, there's lots on the internet to read up on a balanced diet, but go to websites which are known or go to a nutritionist is what is advised. Any other questions?
And again, in those aspects, the lifestyle things, it's about being a role model
Yes,
as well, because that works, nothing else works better than that.
correct. And again, the child is strong-willed, not stubborn. The child wants something, it is because they are strong-willed. How do you use that strong-willed nature to their advantage? Because if we keep shutting that off, then what happens is we see them giving up their studies later on in life. Okay, and as Dr. Gauri has also said, role modeling what we want. I think I covered that in one of my slides as well. Whatever you want. My daughter who has ADHD, she enjoys writing. You give her pages of writing, she will do it. And unknowingly, when she started her writing, I was also teaching in psychology in St. John's, and I used to write my notes. I had a laptop, but I never typed. I used to handwrite. So she used to watch me writing. She'll come and stand next to me. And even till today, I enjoy writing. I make notes, even or handwritten notes for these sessions. So, therefore, it is important to role model whatever behavior you want in your child. Is there
Ma'am,
any?
my last question, ma'am.
Yes,
So now you have whatever you're talking was basically a child only with ADHD. How do we go about with the comorbid situation if it is an ASD secondary to ADHD things, ma'am? Because the kids under a spectrum cannot, follow role play or, anything time sense and all. It's very difficult for us to do it. Can you suggest anything for them, ma'am, especially with the
yes.
kids under the spectrum?
See, it all depends on if the child is verbal or non-verbal. If a child is non-verbal, I would use a lot of pictures to make them understand, to help them. See, we see the child who is cannot speak, let it be autism or just delayed speech. Their frustration to let us know what they want turns out to be a behavioral issue because they can't communicate what they need. So it's always an unmet need. So therefore, tell them in the class if you want to go to the toilet, you should point at this. If you want to drink water, if you all want them to take permission, they should point at this. Give them some tools so that they're able to communicate their needs to you. All right. So, in terms of autism, you can still use all these interventions also. Let me add over here that we say they don't have time sense. All right. Let me tell you, neurotypical children also don't have time sense. Okay. For them, 5 minutes is the same thing. It's because for them, that is childhood. Childhood is not to watch the time. That's our job, right? So we can only tell them by using digital clocks, telling them it's 7 o'clock now. By 7:05 you have to do this. By 7:15 you have to do this. So that means they have to be able to read numbers to be able to do that. So that is how we deal with time sense using big calendars, using big digital clocks, so that they are able to know the time. Okay, but it will develop. They are children. Their brains are developing. These things won't come in so fast. It will take a lot of time.
I think the other thing to understand is the reason behind any behavior or hyperactivity. So, especially in autism, it could be a sensory issue, it could be kind of to escape or other reasons as well. So, once we understand this better, I think we'll be able to deal with it also
Right.
appropriately.
Right. Uh,
Ma'am, there's one more question in the chat box.
yeah.
This is from Miss Shailaja. Ma'am, is there any age limitation for the interventional help?
See, there is no age limit as such, but the earlier you start, the brain rewiring happens better. Otherwise, after the age of 10 years, there are pubertal changes happening in the body. And so, therefore, the body has to develop. So, therefore, if we know that the child has some issues at a young age, now we have so many centers around us, so many hospitals, so much of help. And therefore, take that help as early as possible. The later you take it, it's not like it won't help the child, it will, but it may not be, as fast as it would be if you did it earlier. Yeah.
Hello, ma'am. I have a question.
Yes.
I'm Pashanti. I'm a speech therapist. This is an instance from today in a therapy session, actually. This child that I'm seeing is on the ADHD, and she was doing something wrong, and she also knows the minute she does something wrong, she tore a note. We did not react much. I
Mm,
was alone with the child, the mother was not there. She herself sat down and started repeating everything she would have heard when she did something wrong.
mm,
It was ऐसे क्यों किया, शैतानी क्यों किया, and then she's going on saying things that she probably gets or somebody would have scolded or disciplined her in a different way. So I let her go through that process.
mm,
She said a lot of things, but when I tried to communicate with her after she settled down, she still didn't understand that, okay, uh, she has to come out of this now
mm,
and then probably move to an it was about impulse control. She could not help herself, and then she tore something.
mm,
But then she kept saying
mm,
chocolate dungi ya grapes dungi,
mm.
but could not get her through that understanding.
Yeah.
And when I counseled the parents also, they kept saying that we don't give, but this is the verbatim that she's following. So could you help me how to go ahead with this situation?
See, again, maybe using social stories. I'll just
Hmm.
share screen and show you all one social story. It may not be related to, what you've just spoken, but this is just
Mhm.
a sample of a social story. Um, Using a social story on what behavior you expected from the child is.
Mhm.
Can you see my screen? Sorry, let's see.
Yeah, yeah, yeah.
You get lots more. I've just taken one, like when you go shopping, the how to develop the social skills. So the
Mhm.
pictures are there, and you are going to be telling the story to the child. All right, I get
Mhm.
these from twinkle.com, twinkle.in, sorry, and
Mhm.
they allow you once a week to download one free, so you could do that based on your
Mhm.
topic. Okay, so like this, it is getting the child to sequentially understand or to understand appropriate behavior is one of the good techniques. My daughter also had a speech delay. She spoke when she was like 5.5 years old. We used a lot of that time. I did not know about social stories until I became a special educator, but somebody had given me these books, story books, which says how to say thank you, how to say please, and I would keep reading it for both my children. But there's a story, so it generates an idea with the child of what is appropriate without talking about the child per se. uh,
Mhm.
Also, the parents, you must have already told them that role modeling what to say in front of her, like calling her all these names, may actually make her more upset and more anxious, and
Mhm.
therefore the
Yeah.
child does not, therefore the impulse control may not come because the child is still very anxious. So probably even doing some breathing exercises, emotional regulation, teaching the parents to do it for her may also help the speech. I'm not sure for what the child is coming to you for, because she seems to be speaking at least what her
Yeah.
parents.
Yeah, yeah.
So impulse control, all that delayed gratification, all that we spoke about, parental
Yeah.
guidance is needed.
Right. Yeah, yeah. Sure. Sure, I'll work on that. Thank you so much.
Thank you so much. Yeah.
Ma'am, there are a few more questions from the online registration.
Please.
I'll just read up whichever is, I guess it is being repeated, some of them. So I'll read whichever is missing out.
Sure.
This is from Rishba Sanchiti. She is asking, my daughter could not sit at one place after having fun for whole day. Then also she does not sit and study and she disturbs others. So what can we do?
If I mean, maybe when you're I don't know whether these people want to stay anonymous, so I'm not sure. But if this person is here at the meeting, would you want to tell me how old your daughter is? I don't think she's here. Can't see anybody. Anyway, just to answer that question is that uh, those concentration enhancement techniques is very important. Getting them to play board games, getting them engaged with an activity which is fun, as well as you're training them about sitting tolerance, is very important because when the child goes to school, by the time they're 6 or 7 years old, there is an expectation that the child needs to be sitting for X number of hours at least, and so that kind of training has to happen from home in the terms of playing with them. Through play, a lot can be taught to the child. Um, Sounds like a happy, bubbly girl to me, all right, but we don't know. I don't know what the other issues are. Of course, adults do get tired, and therefore I say always outsource some of the time to a maid or to a nanny to take care of the child so that you can recharge your batteries when the child is comes back to you. Do it in a safe way. Not that I'm saying anybody take anyone, but do your checks there and then outsource it. Yes, Kastuba, any other questions?
There's one more question from Ms. Shailaja.
Hmm.
How to handle behavior issues children? Mainly, what are the don'ts we must avoid to take care of special needs children?
What are the don'ts?
What are the don'ts we must avoid to take care of special needs children?
All right.
Behavior issues.
Yeah. See, children, again, there is a, if you Google up behavior iceberg, okay, we see the behaviors, but what is happening with the child? We need to know the root cause. What is happening in this child? Is it an unmet need? Is the child hungry? All right, is the child not getting love and attention from the family? Is the child not having the skills to speak, not having the social skills to make friends? All these things come up with behavioral issues, especially in special needs children. Okay, so depending on what that need is, we need to help the child to develop those skills so that those behavioral issues will come down.
Yes,
All
ma'am.
right? I just
Yes,
want.
yes, yeah.
I was reading an article by an occupational therapist. Of course, he lives abroad, but he wrote that he was constantly, one child was constantly being brought to him for, behavioral issues. And he one day asked, can I go to the school and observe? And he said, when he went to the school to observe this young girl, he noticed that the girl's legs were not touching the ground, so she has to balance to get into the chair, get out. So she appeared to be very fidgety because just that her legs were not, she was a short girl. Her legs were not touching the ground. So of course, this is in the Western country. They are allowed him to just put a footstool for that girl. And they saw so much of difference in her behavior after that. See, we need to touch something, no? She wants to touch the ground. So she kept coming forward, touching the ground. In that, everything will fall down from her table. So sometimes there are these small things that we may overlook in order to help a child to stay focused in the class. Yes, Kastuba.
Yes, ma'am. This is from Miss Humira Azam.
Huh.
I'm a parent of hyperactive kid. We shifted to UK an year back. Back
Huh.
in India, he used to go for different therapies. Suggestions for home activities for behavioral issues will be helpful.
Can you just repeat that again?
Yes, I am a parent of hyperactive kid. We
Huh.
shifted from UK an year back.
Hmm.
Back in India, he used to go for different therapies. Suggestion for home activities for behavioral issues will
Hmm.
be helpful.
Okay, I'm going to put that file in the chat box, all right, which I was talking about in the beginning of the session. And that will also answer Namrata's question, which is put there. that is on concentration enhancement techniques are some of the activities which you can do. Be creative, do anything that you feel will work for the child. I'm just looking for it on my laptop and I will put it as soon as I get it. Okay. So that question will get answered through that file, which I will be putting in the chat box.
Yes, sure, ma'am. Yes. The next question is from Miss Bindu. When are medications recommended for ADHD? Specify few red flags.
See, whenever a child is very impulsive, okay, whatever you are doing at home, the child is I like this, running across the road many times, touching the hot stove, a lot of complaints from school. These are some of the times that we can think of, thinking about medication. But that is not something that I can decide. You have to go to the psychiatrist, they have to work up the case, and they will tell you whether it is needed or not. Okay, so that is how I will answer it on medication because that is the doctors, they need to decide.
So, a bit
Yes.
to add on, you kind of covered a bit earlier on. You're trying to work on the neuroplasticity, wiring of the brain, and all those things with these kind of behavior management or working on executive functioning or attention, hyperactivity. In spite of doing all these, we still find that there is potential in the child because of the ADHD symptoms. It is holding them back and having a big impact on their day-to-day functioning. I think that is when it is the right time to consider medication. And again, it is about when you start, it is about counseling, for, starting them on medication. It may need dose adjustment, changing if one medication doesn't suit a child. So a lot of things come into it. So it needs to be kind of monitored closely. And
Right.
one more thing is when somebody is on medication doesn't mean it'll fix everything. They still need to continue with the therapy, so the wiring learning still happens.
Correct. Correct.
Yes, thank you, ma'am. The next question is from Tridisha. How to reduce irritation and stimming? I guess
Uh,
the emotion regulation part will help
Again, yeah,
us.
maybe some sensory, treatment from an occupational therapist. Stimming sounds more autistic than ADHD,
Yeah.
but nevertheless, it could be taking the child to the occupational therapist and getting something done from there. I
So
have
Yes, ma'am.
again, a lot of
the
people,
chat.
sorry,
Sorry.
yeah. Lot of people are talking about repetitive behaviors and stimming. So
Yes.
just having one thing to remember is just having stimming is not bad. It's again the impact it has on the child to sit and complete activities, or the impact of the stimming. If it is looking very awkward in any social situation, or it is too much that the child is not able to kind of stop and do other things. But if a child is able to complete their task in between, they do it for a little while, they may be doing it for the self-regulation also.
Yes.
So when you stop this, the regulatory mechanism you're hampering, and then you can actually see other behaviors coming in when you're trying to stop. So it's about getting the right guidance, seeing the therapist and taking their guidance and working on it to know
Right.
how much is okay or how to modify the type of stimming behavior.
Yes. Thank you, ma'am. And there's a last question from Miss Jyoti Yadav. How to help them in regular classroom setup?
Um, I'm not sure in what way, but I'll just answer it very generally. As I said, these children should be up in the front, not as a punishment. Make it like a very, like as it give them the importance that they are getting to sit next to the teacher and so on. Teacher has to have immense patience, give prompts wherever needed, bring the child back to focus, in case the child is wandering off in terms of attention. And sometimes children with ADHD are quite gifted. So sometimes these children might need, different worksheets to do different things in the class. Sometimes they finish faster than the others and then they start, the behavioral issues start because they go around disturbing others. So how does the teacher then engage the child so that the child won't go and disturb the others in the class? Okay, so these are just some general classroom modifications that can happen. I can see something in the chat box
Yeah,
as
yeah.
well.
And to add on, if the teachers are struggling a bit, if the children are going for therapies, it will be nice for them to connect with those behavior therapists or psychologists and understand what may work for that child.
Hmm.
Sometimes it's like what works for one may not work for another. So these are general strategies to look a bit more what will work for the child you're dealing with will help.
Right.
Yeah.
Yes, there's
So,
one last
yeah.
question in the chat box, ma'am. This is from Mr. Arun. I'm a parent of 17-year-old boy with moderate ADHD. How should ADHD management involve as they step into adulthood? They are more mature and understand their condition better, but they still struggle to remain consistent and self-regulate. How can I encourage him to reflect on what is going on with him, seek support, and increasingly address issue himself?
Okay, so there are many little questions from this. If your child is 17 and academics is not going, do seek the help that you need from a psychiatrist and a psychologist in order to help the child transition through his education. Or let him or her, whoever the child is. Um, Okay, then coming to evolving to step into adulthood, all the life skills that you would teach a neurotypical child, how to catch a bus, how to, buy a ticket, metro ticket, whatever, all those things are, you have to take them along with you and train them for those things if that is a need. Okay, how can I encourage him to reflect on what is going on with him? I'm assuming you would want the child to share all of that with you. So it's very important as parents that our body language should be non-judgmental. We might sit with a poker straight face, even that could get the child thinking that is my mother or father judging me. ADHD children jump to conclusions very fast. They have a lot of black and white thinking. They jump to I can't very fast. And so therefore talking, helping him to talk about these things, if at all he's unable, you feel there's something going on and he's not able to talk to you, maybe seeking that professional support will be important. I would also say that use as a parent, use I statements. Say, I know you have ADHD. I believe that, this is what could be an issue. This could be an issue that. Don't say the teacher said you have ADHD. The psychologist said. Then what happens is that then the child thinks that my mom and dad haven't accepted me. How can I open up to them? So it's very important to say I put my daughter in NIOS, and she was one of the few children in the class who was absolutely settled and had no problems why she was put from mainstream to NIOS. And I think it is because, as a family, my husband, my elder son, and myself, we all told her this is good for you, and we want it for you. It's not that the school recommended it or the psychologist. Maybe all those inputs we got, but at the same time, we need to show that this is what we want because family is permanent, not the school and not the psychologist. Okay, I hope I've answered that question.
Yes.
Something else as there, I think you also want your son to be independently doing as well as they're getting into adulthood. Some other ways are journaling, writing down what happened, and then probably if they can discuss with you, well and good. It's about asking them to kind of come up with options when this happens. What else could have been done? How could this have been handled? So it's a reflection. So you may not have straight answers. They may come up with interesting ways to kind of deal. You can kind of suggest things rather than saying, "Oh, this happened. You should have done this." Rather than that, saying, how do you think you could have handled this better? What about these ways of handling that situation? So all that next time they may kind of think and
Yeah. I had
try
shown
it.
the situation cards that I wanted to show them. These are just some examples, like just what Dr. Gauri is saying. You can, these are all again available on the net. You can sit with them and you ask them what they would do. All right, don't be judgmental about their answer unless they say they're going to kill somebody, then you get into something with them. But then you also tell them what you might have done in that situation. So then they're getting an adult perspective. Okay, so these are just what to do cards. You just Google up, you'll get tons of it on the internet. You can make up your own. Okay, and these help to have some good conversations. When my children were growing up, I didn't have these cards. I would cut out things from the newspaper. Or if we were sitting at the table and reading together, I would read something from the paper. And I would say, what would you do in this situation if this happened to you? I would ask her, I would ask my daughter, I would ask my son. Then I would also say what I would do in this situation. All three of us may have been right, but it's perspective building, which is another important area in ADHD. Okay, so keep that in mind here.
Yes, ma'am. There is, Miss Lisa Verma is asking, please provide some resources for controlling impulsivity in early years. How do we instill think before you act mindset?
Yeah, so Lizzie, don't try to control, try to manage. Nobody wants to be controlled. Okay, so try to manage the impulsivity. So let's say the child has done something impulsively, ask them to stop, ask them to go backwards. That's what I said. They don't have that previous memory. So therefore, they do not know what to do next. Go back and say, what should you have done? All right. Don't dwell on what you did was wrong. That don't dwell on that. Dwell on what was the appropriate behavior. I have a lot of children. I used to go to a lot of schools. The children used to tell me that we know that we should not do this, but we don't know what we have to do. So telling them appropriate behavior is important. How do we instill? Don't instill anything, it will come. Okay, children are, they are meant to be children for a reason. So how do we instill think before you act mindset? Both your questions are, I mean, both things are connected. Is delayed gratification. All right, asking, giving them situations, making them think imaginary situations, what will you do next? Then when they're actually faced with that, they will sit and think. So in small ways, age appropriate ways, please do that with the,
So, ma'am,
yeah, yes.
hello, ma'am, this is Lizzie. So, my question was more towards his behavior in school where
Hmm,
I am not present. So, like, let's say he broke someone's project
hmm,
or he hit another child.
hmm,
So, even if when he tells me, generally a note comes in the diary or maybe a call from school.
hmm,
So, whenever we address that, okay, why did you do this?
hmm,
Most of the time, his answer is like my previous question that I don't know, Mama.
hmm,
It just happened, and for no reason I did that. So impulsivity is definitely there.
hmm,
But what happens is while I can address this, have a discussion with him when he's at home, in
hmm.
school it becomes difficult because the
Lizzie, how
setting,
old is your child?
he's 5.5.
All right. If the school does not understand ADHD, if the child is your child has been diagnosed, please do find a school that understands it.
We are yet to get a formal diagnosis. We have been told that he might be
Okay.
having ADHD, but they cannot make a definite diagnostic before he is 6.5 years old.
Absolutely. Yeah.
And while we have told this to the school, the thing remains that whatever he does in the school,
Hmm.
that affects other children as well. So in that moment,
Yeah.
uh,
So
not everyone is very kind
I'll,
or
I will
understanding.
rewind a
So
bit. I'll rewind a bit and tell you I've put concentration enhancement techniques in the chat. Please do those activities with him. It will build. See, when you are playing cards, you can't put a card out of turn, right? You can't, if you're playing snakes and ladders, you can't do. So there is a lot of regulation that happens through these games. Okay, so you play these games with him at home. The complaints may still come for another 1 year, but rewiring of the brain will happen. We don't know whether somebody is bullying the child in this class. There are a lot of other questions that come to my mind when you tell me that he's just gone and done it. Okay, so
Yes.
maybe he doesn't have the tools to answer you. Maybe his language is not up to the grade level in order to give you those answers. So maybe a holistic assessment on him since it's holiday time might help, you can ask Dr. Gauri herself. She will do it. And a holistic assessment will give you lots more information on what areas you need to work at home. Okay?
Correct. Exactly.
Yes.
When you say somebody he's hitting somebody else, that is a reaction to something rather than just accounting it to impulsivity. So it's about understanding the situation, which a 5.5-year-old may not be able to express when you asked what happened. So talking to the school, the teachers is very important here.
Right. Talking to them and also, asking the child what happened before that. Before you hit the child, what happened? Let him think, give him time. And also this, or to all parents, whatever the age group may be, when we use the word why, it is very accusatory. It means you've already condemned the child that he has done something wrong. Ask the child what happened before this. No, in any if I ask you why, Lizzie, why have you not done this, you will immediately withdraw. Okay, so change that language as well. It's something that many of us, need to do in order to get answers back from our children. Okay, I think there was one question from Likita which we met, how to make.
Yes, how to make sit and make concentrate that who is mentally challenged
Right.
children.
Yeah. So children who are mentally challenged, we call them, they come. I mean, the IQ is low, so their understanding itself is low. So they should be given more activities, hands-on activities to do in order to help them to sit. In fact, vocational things work better for these children, so that they would be able to, sit down more. The concentration will develop as their neurodevelopmental challenges. The development will happen, but at a later stage. It will not what happen. Suppose what we see in a neurotypical 5-year-old, we won't see that in a neurodiverse 5-year-old, but you will see it at some point of time. Okay, so therefore the patience is needed, especially with children who are having intellectual delays. Yeah.
Thank you so much, ma'am. That's the questions. Thank you so much for the
Thank
session,
you
ma'am. It was
for
really wonderful.
thank you for helping me with the questions,
No,
Kasturba. And thank you, Brain Trust, Dr. Gauri and Apurva, for inviting me. Um,
Thank you.
Thank you so
So I think to conclude, it went on very smooth with the first session going into why and how about ADHD, and one whole session dedicated to the ways in which it can be managed, and the way it was like cut down into different areas where the problem is and how those things can be helped. So it was very good. One thing what I would like to say is everything a child running around doesn't always means it is ADHD. So hyperactivity could have several reasons. So good assessment, observation, and understanding is the key first step. And I would like to reiterate what Ms. Jennifer Tavares said: diligently, patiently, consistency is the key for any of this. So there are people around who can help. So you don't have to deal with any children alone. I think that is important. And thank you very much for the elaborate and detailed
welcome.
session.
Most welcome.
Yes. So
Just
thank you everybody for joining in as well.
yes, thank you,
Thank you,
everyone.
Kaustuba, for helping out with the
Thank
question.
you, Kasturba.
thank you, ma'am. Thank you.
Yeah.
So